Here's another question, Dr. D'Orazio, I think for you. How do you use peer specialists in your care routines? We've talked about the importance of peer specialists, but how do they come into play in your setting?
They're very important. And like Callie had mentioned, that she, talks about how this peer recovery specialist was able to have this conversation with her that nobody else could really have. They're credible messengers. I show up in the room and I don't have that experience. I can't have that same level of conversation as a peer recovery specialist would with somebody who's admitted to the hospital with a chest tube from an infection from injecting drugs. And so they're really integral in having honest conversations about redirecting the care for a patient. And sometimes as a provider, I come in with my plans that, hey, we're going to get this person into recovery. We're going to get them to X, Y, and Z, and this is how things are going to go. And I have a peer recovery specialist. So it was like, I had a real conversation with this person. This is where they're really at. And this is where we probably really need to go. And having people in the room that can be those credible messengers and have those honest conversations is paramount. Mm-hmm. And so we really try to use peer recovery specialists at every level of care, whether it's inpatient, outpatient, connecting outside the four walls of our institution by having people on the street doing outreach. I think it's so important.
Mm-hmm. This question also from the audience, I think, Callie, you have hinted at. The question is, what can jails and prisons do to help people with substance use disorders rather than causing further trauma? And it sounded to me from your story that when you were in jail, you were getting treatment. It's more like when you were out, things started to fall apart, or there was a gap in services.
That is such a difficult question because the problems with the jails are so pervasive. It's not that there's one thing that's not going wrong. They're overcrowded. They don't have enough staff, unfortunately. Something that I think would be incredible is if there was a continuum of care. If someone is asking, do you have somewhere to go when you're released? Do you need to have somewhere to go that's safe? Because when you're unhoused, you don't have a phone. I don't have like a Google Calendar. You need everything. When someone is living in trauma, I think one of the most important things to do is have everything as low barrier as possible. You miss your doctor's appointment, no big deal. Come in when you can. I really would like to see a warm handoff and a continuum of care.